Hello, I'm Jennifer Kim from the Cancer Caring Center, and with me today is Dr. Jennifer White, who is an occupational therapist and an assistant professor at the University of Pittsburgh. We at the Cancer Caring Center are partnering with the Department of OT at the University of Pittsburgh this semester, and we will be joined by 5 Doctorate of Occupational Therapy students. And I wanted to share a little bit about why we are doing this, why we are creating this partnership, and Jennifer White was going to share a little bit. So Jennifer, can you tell us what OT is and why it's important in cancer care?
Sure. Occupational therapy is the only profession that works with people across the lifespan, but that also engages people with the things that they want to do and they need to do, right? So those meaningful activities, or what we call occupations, or those daily activities. We really, occupational therapy practitioners are experts in enabling people of all ages to live life to its fullest, right? Like that's our brand. But we really do this by helping them promote health and prevent or live better with injury, illness, and disability. And so to me, that really just fits right in with cancer survivors. It's sort of those meaningful activities, the things that make you a unique individual, that if you are living with a chronic illness, especially one like surviving cancer, those are the things that sometimes go by the wayside. And so you as an individual lose that part of you that makes you unique and makes you who you are. And so really occupational therapy is, we're looking at a holistic view of the person. So not just necessarily, sometimes I think people think of cancer survivors, they think of the person who had cancer, but cancer survivors are really everybody, right, that are close to that person who had cancer, their family, their friends, their, just relatives, caregivers. And so we're looking at the whole person with in occupational therapy. And so, yeah, I think just, I just see occupational therapy and Cancer Caring Center just working very well together. I think you've already established such a great program, and hopefully us coming in will be able to enhance some projects and just be able to benefit the members that you have there.
Yeah, and we're looking forward to it, and because I know the 5 students are going to develop a program that will be on Zoom for our patients and caregivers over several weeks, which will happen this semester. And can you tell us, can you tell us a little bit about that program?
Sure, absolutely. So our students are really going to be focusing on, like I mentioned, that holistic approach. They really are going to be focusing on kind of some of the gaps in healthcare, where you and I were talking about this before we started the recording, but you think about the side effects of cancer treatment, and many healthcare professionals are involved in that and preparing people to understand what the side effects of the treatment are. But one of the side effects of the treatment that I think about, and our students have thought about, is that not being able to participate in those meaningful activities, right? The occupations that you do, your habits, roles, routines that you do on a daily basis that make you who you are. So our students are really focusing in on those gaps in care, thinking about the patients or the cancer survivor psychological well-being, as well as helping them to re-engage in participation with their meaningful activities. So we're thinking about not only the individual, and as I mentioned before, we're really thinking about their family, their friends, their colleagues, thinking about helping them advocate for themselves with other medical professionals, which I think sometimes gets lost in the mix. We forget as healthcare professionals that it's a different language when you go in and you're talking to somebody who may not be familiar with healthcare. And also thinking about advocacy or talking about, you know, employment with empowering our cancer survivors to talk with their employers about what they need. So those are that's that sort of holistic approach that I've been referring to. And, you know, it's interesting. I was thinking, you know, when you're thinking about that advocacy for yourself, when you're when you're talking with your medical professionals, if it's, you know, your physician assistant, your nurse practitioner, your doctor, it's like I mentioned, it's a different language, and I don't think I appreciated that. Even having been in healthcare for as long as I have been, I worked as an OT for 14 years, and it wasn't until my father was in the hospital. He had prostate cancer, and it was the end of his life. And it wasn't until then that I realized that I had the skills to advocate for my father because of the 13 or 14 years that I've had in working in acute care hospitals. And so, and, you know, it was sort of, you know, I just started talking, and my family was kind of like, who are you? And I was like, I think this is the first time they realized I'm an adult. But that it is that advocacy for yourself, or having somebody there who can speak the language, right? And so I know that that is a big piece of what our students are thinking about doing.
Well, that's incredible. And that, I mean, it's basically removing barriers, allowing you to get back to the things that bring you joy, the things that are preventing you from socializing pre-virus and post-virus, but just being back as a member of the world like they were prior. And I think OT does it really removes barriers. And also, like you were saying, I think advocating is really critical. And a lot of people either don't even know to ask about these challenges that they're facing, maybe socially or just in their hobbies, because they think that might not be something the doctor would be concerned with, but also, you know, teaching them that there is help, that you know, that there are ways to overcome some of these things, whether it's through the doctor or whether, you know, because occupational therapy can be a huge assistance to getting back to normal life, or even making your life better than it was before.
Absolutely. Just really looking at ways, right? We know that some of the side effects of cancer treatments are fatigue and pain, you know, cognitive dysfunction, depression, right? And sort of, you know, our students are really focusing in on how do you either compensate for those deficits, how do you restore function because of some of the side effects, and again, with that focus on finding out what's unique to that individual and giving them that self-efficacy so they can participate in the activities that really do bring them joy and make them the unique individual that they are.
Yes, well, we can't wait. We're looking forward to this. I hope that everyone will stay tuned, and we'll be meeting some of the doctorate candidates that are going to be joining us, and look forward to hearing more about our program soon. So thank you, Dr. White, and we'll talk to you soon.
Thanks, Jen.